Are you a pharmacy student interested in learning more about postgraduate residency and fellowship opportunities? In this video today, I talk about how to prepare for residency interview questions. Stay to the end where I talk about what to expect on interview day. Hi everyone, I'm Dr. Jessica Louie and I'm an associate professor, board certified critical care pharmacist, and entrepreneur. I love helping people find meaning beyond a job title and let go of burnout. On this channel, we talk about passive income and simplifying to combat burnout. I also share openly about my burnout story and how we went debt-free from massive student loan debt. Make sure to watch those videos below. This video is part of our residency roadmap series, where you learn how to prepare for residency as a P1, 2, 3, and 4 student, how to prepare for interview, how to find the right fit for your programs, and how to rank your programs. This video is not associated and not sponsored. It is my personal opinion. If you don't know my own journey, I completed a PGY1 in 2014 and a PGY2 in critical care in 2015, both from ASHP accredited programs. Congratulations on making it to interview day. This is a big event after a program has reviewed your written application and something to be really excited about. To start preparing for residency interview day, we're going to break it down into 6 simple steps, and I'm going to talk about what to expect on actual interview day at the end of this video. The first step in preparing for residency interview questions is to review the STAR method, STAR or STAOR method. If you're not familiar with it, let's break it down today. S stands for situation, T stands for task, A stands for action, O stands for obstacles, if there were any, and R stands for result. When we're looking at the STAR method, it's really important to be really detailed in your interview answers. So reviewing the STAR method can be really helpful to prepare for different behavioral types of questions you're going to get asked, so that you have the details of presenting an example situation where that behavior happened, talking about what the task was at hand, what action step you took, if any obstacles or challenges arose and how you conquered them, and what was the end result, whether the end result of the actual situation that happened or the end result of how you're improving yourself and learning from that situation. Overall, the STAR method can really help you stay concise and relevant to the question, give specific examples, and give action steps that you've taken. I start with the STAR method in the interview question process because often I see that students are not giving enough detail and enough example in the answers, and then it can be really hard to know what their past experiences and past skill sets have been and what they're working on to improve and grow as a person. So this is why I think it's so important to highlight this method so that you can start writing it down in different examples and different behavioral type questions you might get asked in an interview setting. The second part is to start reviewing your curriculum vitae and letter of intent, your CV and LOI, for any information that you wrote in each of those written documents during the application process. And this is really important because anything that's on your CV or letter of intent is fair game to be asked in an actual interview setting. So whether that means reviewing some of the past presentations you put on your CV, the past journal club articles you put in your CV, the past work experiences, and pulling specific examples from those work experiences can be really important. It also could mean that you're reviewing any research that you put on your CV to make sure you are familiar with it. Maybe you published it 2 or 3 years ago and just need to reread that manuscript or that poster you presented. Maybe you need to review, your leadership roles and it happened a few years ago, and review what types of events you planned and what was the outcome of some of those events. And then finally, you might need to review some of the interventions you made during rotations and any of the rotations, IPPs or APPs that you put on your CV or letter of intent that you wanted to then turn into more clinical questions that you're going to answer with. The third step in preparing for residency interview questions is to potentially prepare a presentation for the interview day. And this could be a presentation to showcase your knowledge on a disease state, a drug information question, a specific medication, or a topic outside of pharmacy. Typically, presentations are done to see your verbal skills and see your critical thinking skills and see how you answer questions on the spot about a topic that you're presenting on. The next way to prepare for residency interviews is to prepare for all the clinical questions that might arise during the interview. And yes, the majority of questions during the interview day are likely to be behavioral in nature, but there's likely to be some clinical questions, whether that's from your CV or letter of intent or related to the specific specialty you're applying into. So let's say you're applying into ambulatory care specialties, so likely there's going to be more chronic disease state type of questions coming from that program, whether it's chronic diseases such as asthma, COPD, hypertension, dyslipidemia, heart failure, those types of questions that you would see in practice quite often. Your acute care residency programs might be asking more of those acute disease state type of questions, whether that is infectious disease related, anticoagulation, like DVT, PE, stroke related, acute coronary syndrome related, with our heart attacks, maybe electrolytes and other types of IV medication type of questions. Now, if you are presented with a clinical question during an interview and you're not sure how to answer it, please take a pause and a breath, and then think about how you're going to critically think through the process. Where would you go find the information? Talk through your critical thinking process, and then if you need a follow-up after the interview with an email to answer the question after you've looked it up with some drug resources, you can always follow up afterwards. But being able to talk through that process and talk through how you'd find the answers is also very important. The fifth way to prepare for your residency interview is to prepare to answer questions specific to the program and the institution. And this means researching the program and the institution's mission and value statements, typically presented on their website, because the program is part of a larger healthcare institution in general. This also means that you've researched the services offered by this program or institution, and you are very clear when they ask you why this program. You have a clear answer to align it back to the mission, values, and possibly service offerings that the program or institution has. Researching this will also help you ask the program different questions as well. And that leads into our sixth way of preparing for your residency interview, is to prepare questions to ask the program. Remember that you are interviewing the program as much as they are interviewing you. You're seeing if this is the right fit for you to spend 1 or 2 years of your life training and learning at. And for some programs, it's not going to be the right fit. So being able to ask the program these questions and prepare them in advance is very important, so that you make an informed decision of what's best for your learning style and your growth as a person. You can watch this YouTube video on how to find the right fit for a program. Now, what are you going to expect on the actual interview day? Now, each program is going to format the interview day slightly different, but typically the interview day is going to be a full day event. Maybe a half day in some institutions, but most are full day events. You've made it to that interview process. You've been a select few that have been invited into that interview process. And during that full day event, you're likely to encounter both one-on-one interviews, so just you alone with one other person, like the director or another pharmacist, or a panel interview where you are there alone and there's a panel of pharmacists or directors or even current residents that are asking you questions. And then besides the panel interview and the one-on-one interviews, you're likely to also experience either a presentation or a written essay or a lunch session to take a break from the interviews. Now, the interviews typically last 30 to 60 minutes, so that is a pretty long time, and it gives you opportunity for them to ask a set number of questions. Usually those are prepared in advance by the panel, and then you are also able to ask them questions. So they might be leaving 15 to 30 minutes for you to ask them questions. Typically, a lot of panels will ask the same question or a similarly worded question to you, and this is intentional, so they can ensure that you're answering the question the same way throughout the day. So if you do have a repeat type of question or a really similar question that comes up, I do recommend answering it very similarly throughout the day, because we don't want to hop back and forth with different types of examples that aren't relevant to one another. The essay portion, it could be a small portion of the day as well, where they are ensuring that you wrote your own letter of intent and you're displaying competence in the English language, English grammar skills, and it could be relevant to a recent pharmacy topic that's come up that they're going to ask you to write on. The presentation could be short, it could be 15 minutes, it could be an hour, it really depends on the program and the type of presentation they're asking for, and the presentation might be given to all the other candidates that are interviewing that same day, where we're taking a few hours where each candidate gets up and and not only is the pharmacist and the current residents viewing and watching your presentation, but the other candidates that are interviewing are also viewing your presentation. The lunch session might be with the current residents, and remember the current residents may have a vote in the ranking process, so please make sure that you're keeping it professional during the lunch session as well, because it could play a role in how the program ranks you. Now, at the end of the interview day, especially if it's a full day event, you probably have a lot of information floating around in your brain and a lot of feelings coming in. And this is the best time to start documenting all those feelings, all those notes that could be carrying around in your brain. So I highly recommend, once you leave the interview day, that you take, 10 to 30 minutes to write down some of these feelings and these thoughts. Or my preference is to record an audio message to yourself, talking through some of the feelings and thoughts that you have right after the interview day. This is really important so you can play back that audio message or look at those written notes when you're going to rank the programs in March and have a feeling of how you felt at the end of the day, if this is the right fit for you. You can also watch the following video on how to rank residency programs here. Those were 6 steps to preparing for your residency interview day and what to expect on the actual interview day. Make sure you're taking action and getting your CV, letter of intent, and interview questions prepped and ready to go. If you need additional resources, they are all linked below with our online workshops and coaching. Until next time, cultivate joy.